Just trying to put some motion into his shoulder joint, his glenohumeral joint, his true shoulder joint. Any adhesions that build up in the capsule and any of the ligaments that are attached into this joint, we're just trying to work those through their full range of motion. And I'm changing directions, clockwise, counterclockwise, almost like a figure 8 motion. Plus with my thumb, I'm holding some of those tight muscles again, so
You hit it right there.
he has a big knot here in his trap, so I kind of move his shoulder while I'm doing the trigger point work. Dr. Randy, hey everybody. I got Ed in the office. I'm gonna do a quick shoulder exam on him, and he hurt his shoulder, pulling a lawnmower, doing guard work.
Yes.
It's a common problem we see in the office. You know, I know we talk a lot about neck pain, back pain, mid-back pain, but we also do a lot of extremities, shoulders, elbows, knees, hips. So he came in with a shoulder problem, so we want to demonstrate a quick exam we're going to do on his shoulder and how we would treat this particular problem. Okay, ready? Arms like this for me. Kind of by your side. By your side. Just relax them, okay? I'll tell you what to do. Don't let me push in. You ready? Don't let me push in. Hold, 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 hold. Don't let me push out. Hold, 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 hold. Don't let me push down. Hold, 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 like that. Good. Can you put one arm like this? Do your good arm first. Can you go up with it? Good. Go other arm. Can you go up with it? A little discomfort there, a little pain there. Relax it. Can you go behind your back at all? Good. Go behind your back with the other arm. Any pain or discomfort there?
Yeah.
What about over top like this? And how far can you get down? Pain or discomfort there? Okay. Yeah, I can see him grimacing. Okay, other arm. Good. Relax.
Okay.
Now out like this. There you go. Don't let me push down. Ready? Hold, 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 hold. Okay, relax it. All right, so we did some orthopedic tests. We did some muscle testing. He's certainly a little weaker on his right side. He has some positive orthopedic tests for a right shoulder, probably pain, sprain, things like that. So no dislocation, nothing severe, but that's just a quick example of a test we'll do on somebody when they come in to make sure they don't need referred out immediately to, let's say, an ER or to an orthopedic. Now we know we can treat him for, for a shoulder problem. So go face down for him. Had this been bothering you for a while, or you just?
Yeah, about a week.
Yeah. All right, so when we're taking care of shoulders, a couple things we're going to do. Number one, we're going to adjust his thoracic spine and his neck. We're going to adjust his shoulder. We'll talk about that. But the first thing we're going to do is work on some of the soft tissue around the shoulder. What happens with a lot of problems when it comes to shoulder pain is he's feeling a lot of his pain where in the front here, a little bit on top.
Yeah, in a scapular region.
And he's getting some of the scap back here as well in his scapular wing region. A lot of times patients will say they feel a lot of the pain up front in the anterior part of the shoulder, or maybe they'll feel down into their deltoid muscle. The problem is usually in the back though. The problem's with the bigger muscle groups of the shoulder, your trap, which runs up, has several area of fibers that run up to the neck, that run to your thoracic spine, that even run down to your mid to lower thoracic spine, or his rhomboids, which are in through here, levator scap, and then certainly his rotator cuff muscles. So the problem's usually in the muscles in the back of the shoulder blade back here. And there's adhesion, there's scar tissue buildup, maybe there's an overuse injury or a repetitive use injury, or it could be trauma, it could be one incident. The muscles don't fire and function the way they should, and then so the ligaments and the tendons begin to take over and do more work than they're designed to do. And then you end up with either tendonitis or a shoulder sprain or a more serious problem because of the initial muscle dysfunction and joint dysfunction back here. Okay, so we've been doing some soft tissue work on him. I'm going to continue to do, some for another few minutes. One of the areas he's really sore is where his infraspinatus and his subscapularis, his external rotators of his shoulder that kind of do this, even his lat a little bit, and where they're kind of lateral way out here and they insert up way out into the shoulder. So all of these muscles on him. What were you doing? What kind of work were you doing? Like a lot of repetitive?
Yeah, repetitive pulling.
He was doing like a lot of physical labor, so a lot of pulling and pushing and lifting, and so his upper body, shoulders, is taking a beating. So, anyways, we're on these rotator cuff muscles, and they're super sore. You can't see his face, but he's definitely in pain. You can hear him a little bit, but anyways, this muscle work doesn't seem like a lot, but it's going to loosen up these muscles so they fire and function properly again. So we're right along this, like I said, this infraspinatus here, which is one of the big players of the rotator cuff, and kind of fall all the way up to where it inserts. And I'm going to get on his trap again here a little bit, and then we're going to adjust you and adjust your neck. Okay. Take a deep breath in for me, Ed. Exhale. He's a little tight through his thoracic spine. He's always been. So instead of forcing, trying to get things to move, we set a drop. All our tables are drop tables. And we can just give a nice little impulse into the joints that are restricted in his upper thoracic spine. And we'll get, with the drop, amplifies that and allows for a more effective adjustment without having to really push hard. So it's actually for patient comfort, and it increases the effectiveness of the adjustment. So we set that drop right here, and we hit these thoracic joints that are restricted, that are tight. He was having a lot of mid-scapular pain, and a lot of that's because he's so tight through here. Getting a lot of upper thoracic pain, upper back pain essentially. Now he did his doing yard work. People working from home, people at a computer a lot, people driving for a living, delivery drivers, things like that. They're gonna get a lot of tightness in their shoulders. If you don't do anything for it, it'll eventually, your pain will eventually go away, but you're gonna lose a lot of function over time because you're gonna have so much scar tissue build up. And you're not going to recover, going to be less resilient, and many people think that's just an age thing, but it's not. It's wear and tear and stress that builds up in especially your spinal joints. So you got to maintenance them, you got to get them adjusted, you got to break through that scar tissue buildup so you can maintain, functionality as the years go on. Couple more there. All right, now I'm going to do a few things just for the shoulder, and then we'll get you face up. Just gonna bring them out like this. Gonna do some figure eights with this glenohumeral joint here. You okay? Mm-hmm. Just relax your shoulder here. Just trying to put some motion into his shoulder joint, his glenohumeral joint, his true shoulder joint. Any adhesions that build up in the capsule, and any of the ligaments that are attached into this joint, we're just trying to work those through their full range of motion. And I'm changing directions, clockwise, counterclockwise, almost like a figure eight motion. Plus with my thumb, I'm holding some of those tight muscles again, so
You hit it right there.
He has a big knot here in his trap, so I kind of move his shoulder while I'm doing the trigger point work. Good, and I'm just gonna do some extension. I'm just kind of distracting his shoulder with that soft tissue. Kind of move in all different directions and go face up. We can also I can also have Ashley, who's behind the camera now, do ultrasound on the shoulder capsule. We can do muscle stim, we'll ice in the office, slide down a little bit. Right there, across these arms. Just relax, take a nice deep breath in and roll back on my hand here. Let's see if we can get, there's a little one there. Deep breath again. Blow it all the way out. Good. All right, so far so good. We're actually getting, for him, some good movement in his mid-back. And we're going to do a little traction for his neck. We have a table that does this too. We can put people on. Pick your head up. Relax it. But I kind of sometimes just usually like to use a towel because I can control it. And we're just going to hold a nice little pull. You okay there? A lot of muscles of the shoulder run up into the neck. So the neck's usually involved just as much as your mid-back is. So you got to treat the neck when you're looking at the shoulder. You okay there?
Yes.
Good. Is your shoulder pain getting better or worse as the day goes on? Meaning, does it feel good in the morning and then get worse with activity, or does it feel worse in the morning and loosen up as you're active?
It feels, I can feel pain in the morning. And
Worse
as
in
I
the-
go, it gets better. And then I sit down, it gets worse.
So he said he feels a little worse in the morning, then gets better as the day goes on. What that's a sign of is there's some scar tissue, there's almost some arthritic change built up. And that's true with any part of the body. If you feel worse in the morning, more than likely, like while you're sleeping, that scar tissue gets to settle in and you're stiff and sore when you get up. And then as you move and blood flows, you feel better. If it's the opposite, if it's not an arthritic problem, but you have like an acute injury, almost like some damaged tissue that's no arthritic change involved, you're more likely to feel better in the morning because you relaxed and rested, and then worse as you become active during the day. You okay?
Mm-hmm.
We're gonna end with a nice light neck adjustment here. Just relax your shoulders, keep your hand on your lap like that. Relax your neck for me, nice and easy. That's good. Good. One more. Good. And this way, nice and easy. Relax your neck all the way out. Let it drop into my hand, Ed. There we go. Okay, so that's his basic shoulder treatment. Adjusted his neck, we adjusted his upper back. We did some range of motion work with the shoulder. We started with the shoulder exam, some trigger point work. Now we may throw some ice on him now and some muscle stim. And I'm gonna give him some exercises to do. In fact, I'll do it here on video. You can sit up for me. So some of the basic exercises we're gonna start off with him that we'll do for a lot of our patients with shoulders. You can turn and face me. Number one, we're gonna start with a nice light doorway stretch. So just a doorway stretch. You're gonna put both arms on the door frame and lean in. And I can feel this. I knew you doing this more. You're stretching your pec minor, your pec major, and the front part of your shoulder, your anterior part of your shoulder. Again, so many people are so forward all the time. We need to stretch our shoulders back and stretch this chest muscle out. So this contracts and pulls this shoulder forward. So just do a doorway stretch for 30 seconds. Okay, that'll help you keep your shoulders back.
Okay.
Second, now stay there.
Okay.
Second, if you can do it, and we tested his shoulder capsule, I don't think anything's torn. I want him to do a wall stretch. Get up against a wall. I want your hands flat, your elbow flat against the wall, and maybe go up and down 10 times. Okay? Up and down, nice and easy. And again, you're working on strengthening and stabilizing these posterior shoulder muscles that for everybody get pulled forward. Last but not least, I want you to do what I call YWTLs. So watch me. You're going to put your arm in the shape of a Y, a W, a T, and an L, but the whole time you're going to squeeze your shoulder blades together. And his shoulder is in like a little bit of acute spasm now, so we're only going to hold that each direction for maybe 5 seconds. You can work up to maybe 30 seconds or a minute. These would be the best exercises I give them to everybody who are having, whether it be shoulder or mid-back pain, to eventually work up to help strengthen the mid-back. So I'll go again. Do it with me, and I'm going to help you. Put your arms in the shape of a Y, thumbs back, palms in, and try to squeeze, try to touch your shoulder blades almost. Thumbs back, no. Thumbs back, like that, yeah. Squeeze here, good. No, what are you doing there? Here, just like that.
Okay.
Yeah, now go to a W, thumbs back, palms in, squeeze shoulder blades, perfect. Perfect, then go to a T, squeeze here, palms up like this, good, hands down, and then 2 mirror image L's. Get your arms way into your side there like that. 90 degree, just relax there, 90 degrees, good. So this is a good one here, squeeze here, Ed, squeeze, now relax. You can relax your arms.
Okay.
Feel how you work these muscles here a little bit? Okay, so even just doing that little bit, now you can already feel how you work these mid-thoracic muscles that are almost impossible to get anywhere else.
Okay.
So in summary, again, that's a doorway stretch. This was the easy one, feels good to do. Just lean in, stretch your pec out for 30 seconds. Then get up and do your wall stretch. Hands flat against the wall, up and down for 10 reps. And then your YWTLs. Start with holding for 5 seconds. You squeeze those shoulder blades and work up to 30 seconds. Okay? Thanks.